Good afternoon, and welcome to today's webinar. I am Kirsten Benetti, a board member for Mount Sinai's Institute for Climate Change, Environmental Health, and Exposomics. We are thrilled to have you join us for this important discussion, part of the Institute's community webinar series. This series is dedicated to translating cutting-edge research into practical insights for families and communities, empowering everyone to make meaningful changes in their daily lives for better health outcomes. Today's topic, the importance of healthy school environments, is near and dear to my heart. As a person who suffered from an environmental illness, I know the importance of making sure the space you are in is safe. And as a parent, we send our children to school every day for upwards of 6 hours, and it's truly their home away from home. Unfortunately, many school buildings face structural challenges and other environmental issues that can jeopardize students' health and learning. It is critical that we as parents understand our schools' challenges and advocate for safe, healthy spaces for our children. We are absolutely privileged to be joined by two distinguished experts from the Icahn School of Medicine at Mount Sinai. Both doctors helped me personally when my children faced environmental issues in their schools, and they are truly phenomenal. Dr. Maida Galvez is a pediatrician whose work focuses on reducing health disparities by promoting safe and healthy environments for children and their families. Dr. Galvez has extensive experience in advocating for policies that improve community health. Dr. Sarah Evans is a researcher specializing in the health impacts of environmental exposures on children and often talks about these exposures to communities. Dr. Evans' work translates complex scientific findings into tangible, actionable strategies to improve children's health and resilience. We truly hope today's discussion will provide valuable insights and inspire positive change within your communities. Now let's dive into this essential conversation. Please put your questions in the Q&A, and we will do Q&A at the end of the presentation. Now, Dr. Galvez, you may take the stage, followed by Dr. Evans.
Thank you so much, Kirsten, and just thankful for all you've done to help champion healthy environments for all families. Hi, everyone. It's nice to see so many friends in the audience. I'm going to just click to the next slide. As Kirsten said, today's topic is healthy schools, healthy children, and so glad to be joined by both Kirsten and Sarah Evans. I'm fortunate, and one of the things I'm most very grateful for is that we work with this amazing environmental health community that for decades has been raising the alarm about the importance of healthy environments in schools, where children spend the majority of their time. So from pediatricians to environmental advocates to community organizations and community partners, they've been sharing their work to promote healthy environments. And you see some of the headlines that are a result of that work: the impact of school building conditions on student absenteeism in upstate New York, asthma hospitalization rates among children in school building conditions by New York State school districts, and identifying and evaluating school environmental health indicators, and then ultimately who's in charge of children's environmental health at school. And so all these headlines point to the same sort of bottom line, and it's that environment makes a difference, and school environment in particular makes a difference. And so a little bit on school stats. So there are about 55 million pre-K to 12th grade students in the United States, and this is from a 2021 and 2022, both private school and public school survey. Children spend on average 7 hours a day over the span of 180 days per year. Some of you may have children that spend well more than that, 7 hours per day. And some spend so much time, and it might feel like they're spending more time in school than they are even at home. There are over 100,000 K-12 public schools nationwide, and that's just the public school stats. And for that, according to the U.S. Government Accountability Office, an estimated 54% of those public school districts need to update or replace multiple building systems or features in their school. And this is 2020 data, so just at the beginning of COVID. Kirsten mentioned, I'm an environmental pediatrician, and I co-direct the Region 2 Pediatric Environmental Health Specialty Unit together with Dr. Perry Sheffield. It is funded through the Centers for Disease Control and the U.S. Environmental Protection Agency, and currently managed by the Public Health Institute. It is a go-to resource if you have environmental questions, whether you're a clinician, a public health professional, or a family or community member. So I encourage you to take a look at that national website. We here at Mount Sinai serve Federal Region 2. That's New Jersey, New York, Puerto Rico, and the U.S. Virgin Islands. And there's a PACU in each federal region, and you can go to this website to find an expert in your region. We're really fortunate in that the foundation of the PACU here in Region 2 has led to a New York State-based network. And so there are 10 PACUs in the country. There are 7 centers of excellence in children's environmental health here in New York State, in Albany, Buffalo, Syracuse, Rochester, Westchester, New York City, and Long Island, and funded by the New York State Department of Health. And this is a first in the nation state-based network, and really grateful for New York State and leading the way for how to begin to provide needed services for families and communities across urban, suburban, and rural areas. And you see here a picture of our New York State network. And this work has been included in the National Academy's workshop proceedings towards the future of environmental health sciences. And so we hope that we are the first of many state-based networks in children's environmental health. One of the core areas of work for our NICE check, the New York State Network, is an environmental health scholars program, because our team here at Mount Sinai benefited from the training program in environmental pediatrics here. We've embedded a similar program in the NICE check network, but have expanded it to encompass clinicians of a variety of disciplines, including MDs, but also RNs, so nurses, social workers, respiratory therapists, as well as post-vax and community organizers. And so really a multidisciplinary training program. And it happened to be the first day, June 7th, when the skies turned orange in summer 2023, was the first day for our first Mount Sinai NICE Check scholar, Emma Chang, who's pictured here. And she walked into the office that day, recognizing that something was amiss, and we started getting questions from families and clinicians. And those questions included: should my child have recess? Should my child go on today's field trip? Should my child go to his or her soccer game or sports game? Should my child go on the school trip to the Yankees game? And so all the questions were related to what a child's activities encompass. And it wasn't surprising to us that they were all related to school activities. And so the team here at Mount Sinai got busy working together with center scientists, community partners, city, state, federal agencies, and our colleagues on the West that have dealt with wildfires for far too long and are expert on this, and crafted key messages that then pointed families and clinicians and public health professionals to needed resources. And this was widely disseminated through patient channels, through community partners, and through Department of Health and Human Services and beyond. We were about to send out our key messages when the air quality at 3 p.m. Hit over 300. New Yorkers very quickly turned to the air quality index. We had not anticipated we would exceed that level. And so we held the message for a second and crafted tailored messages specifically for that highest level of concern. So as many know, New York City that day was the worst air quality for any major city in the world. And there's a US EPA virtual air quality flag. That level corresponds to a purple flag. So this is both a virtual flag, and there are actual flags that can be placed in schools to alert the community to air quality concerns. At this level, you move all activities indoor, reschedule them to another day. And that, in fact, is what happened. So the Yankees games, which originally took place, the 2 subsequent games were postponed. This is a picture of a New York City school playground the evening of June 7th. And whenever I pass by a playground and see it empty, it makes me pause. And this was empty because of the air quality concerns. And that makes me, as a pediatrician, very sad that the the business of play that children are supposed to be taking part in is something that they could not because of environmental concerns. And something that happened for the first time in New York City that week is that New York City public schools went remote due to pollution from wildfire smoke. And so what's happening routinely for children today in terms of school closures and inability to play outside is profoundly different than the childhood that we had in the 70s. And so just want to pause for a second and recognize the impacts that this is having on childhood. Wildfires, extreme heat, and climate-related events are not only impacting water quality, it's bringing forward extreme weather events like this. So more than 150 New York school buildings flooded, and one had to evacuate. This was in September of the same year, causing disruption to the school day. When you have extreme weather events like hurricanes, it brings forward concerns around mold. And so the PACU network has this guidance for mold, both in homes and schools. And this is something that we saw, for example, post Hurricane Sandy and more recent hurricanes like Hurricane Maida and so forth. The EPA's report on climate change and children's health and well-being in the United States, published in April 2023. The key findings include that small temperature increases of just 2 to 4 degrees Celsius lead to 4 to 7% reduction in academic achievement, are associated with a $7 to $13 billion loss future income per graduating cohort, are associated with 35 to 90,000 new asthma diagnoses per year due to outdoor air quality concerns, including the fine particulate matter or PM 2.5, ozone, wildfires, and dust. Are associated with 6,000 to 10,000 additional ED visits due to allergic asthma, and 40 to 120,000 more allergy medication prescriptions per year. And so you can't open up the newspaper without reading an article related to climate change these days. And so here's an article on how Newark, New Jersey schools struggle to keep students cool and how many buildings lack air conditioning despite years of calls for improvement to old buildings. And oftentimes when I look at the science, it's not rocket science. These are things that we know have health impacts. And so another article in the New York Times about how heat affects the brain, high temperatures can make us miserable. And how research shows it can make us aggressive and impulsive, and has also been associated with increased violence, including gun violence. I'm going to shift gears and walk through a couple of other school cases that we've been involved in, and this is from the archives, but an important case of a Franklinville, New Jersey daycare that operated in a former mercury thermometer manufacturing company. And operated for over 10 years until it was discovered that it had been licensed for a daycare, and indoor air testing revealed elevated levels of mercury vapor in that daycare in the school. That daycare was permanently closed. Now, the good news is this resulted in Katy College legislation that said that you must look above and beyond concerns for lead and asbestos, which were the two criteria that schools were assessed with prior to that, and that you must consider historical use of the buildings. Typically, when I present this slide, I say, what do you think this building is? This is a Healthy Schools talk, so you all know this is a school building. And that, to me, also makes me sad as a pediatrician, because what does it say to a child about how we value their education and how we value them when these are the types of buildings we're sending them to school in every day. This is another case from the archives, the PS 51 Bronx New School, which operated as an elementary school in that was formerly a lamp manufacturer and part of a auto mechanic shop where they used a metal degreaser called trichloroethylene. When indoor air testing was voluntarily conducted by the School Construction Authority as part of testing prior to renewal of the lease, it was found that the indoor air levels of that metal degreaser exceeded occupational standards for an adult. And that school was permanently closed. It was moved 2 miles south to this former Catholic school building that had the Catholic school had closed. And you can see what a tremendous difference just the physical environment makes in terms of saying to the children that we think their education is important. Construction is a very common case that comes to us as a pediatric environmental health specialty unit. This was a school in Brooklyn where construction was leading to dust contamination of the indoor classrooms. And there was a lot of concerns raised by the parent community. And our PASU joined parents in community meetings. And in order to explain what was going on to children, my colleague, Dr. Cabby Collins, crafted messages specifically for the children. Now, children should not be exposed to construction-related dust, but these are the key messages that we shared with them. Every school building needs regular maintenance to keep the school safe for the people inside, but working on the building can create a lot of dust. And while the work is going on, it's important to stay healthy by washing dust off your hands if that happens. And that's especially too if you before you eat and after you've been playing outside. So really thinking about all the folks that are impacted and how to share actionable messages. Now, a silver lining of COVID, the COVID pandemic, is the attention that's been given to ventilation since 2020. This is a media message that was shared by the National Environmental Health Partnership Council through the CDC, the Centers for Disease Control, and the American Public Health Association. It's a council that I sit on. COVID-19 has shined a light on a long neglected issue. Ventilation matters in schools and early learning environments, and you can take action by developing and implementing a school indoor air quality management plan. And so it stresses the importance of routinely assessing and monitoring indoor air quality and ventilation, maximize the performance of heating, ventilation, and air conditioning systems, otherwise referred to as HVAC systems. And most importantly, use an equity lens to direct resources to schools in greatest need, including high poverty communities and communities in color, otherwise referred to as environmental justice communities, that oftentimes bear a disproportionate burden of a range of environmental exposures, and for those reasons suffer higher rates of common conditions, childhood conditions like asthma. Because of the emphasis on ventilation in schools in COVID, we now have the City Department of Education and Department of Health prioritize ventilation and very rapidly and transparently have published school ventilation status for every public school building in New York City. And so you can go onto this website, find your school, and get information on ventilation status in every classroom, every closet, every hallway in that school building. It's pretty amazing what was accomplished during a very stressful time. And this is the kind of work we hope is happening across the country. EPA also has incredible resources around healthy school environments, including the importance of schools as a source for both cleaner air and as cooling centers as we face warmer and warmer temperatures. This is an example of an infographic that's in that EPA document, schools as cleaner air and cooler centers. So as smoke enters through or around windows and openings and enters cracks in the walls, the HVAC system captures particulates using air filters and odors. It also captures the odors using carbon filters, and the portable filtration units also capture particulates. And then the HVAC units, the cooling units are extremely important given the number of schools as potential cooling centers in communities as well. We're really fortunate in that our New York State Department of Health has a school environmental health program. They have featured webinars and presentations that are publicly accessible, as well as ongoing trainings. This program's led by Dr. Michelle Hurt. And we've also been working to increase attention through publications, so contributing chapters on school environmental health in the 2 textbooks on the left. The most recent edition of the Textbook of Children's Environmental Health, edited by Drs. Ruth Edsel and Dr. Landrigan. And there will be a 5th edition of the Pediatric Environmental Health Handbook from the American Academy of Pediatrics, as well as contributing chapters on environmental concerns in foods in the Pediatric Nutrition textbook, and clinical concerns in the Environmental Health Foundations for Public Health textbook. And with that, I will turn it over to Dr. Sarah Evans to tell you more about what now we can do to address some of these concerns.
Thank you so much, Maida. So when we respond to cases like those that Maida just described, we typically organize our messaging into what we think of as the what, so what, and now what framework. And you just heard about some of the concerns about school health, why it matters. And now I'm going to shift a little bit to focus on the now what. So that's what can we do as families and communities and practitioners and researchers to create safer school environments. And the good news is that we've really learned that both parents and youth can be the best advocates. And I'm going to share a couple of examples of where they've been successful. And I'm just going to briefly share resources and programs and innovations that we often recommend that can be utilized across school districts to improve the health of the school environment. And I'll run through them sort of quickly so that we have time for Q&A, but we will follow up with sharing some of those links after the talk. Next slide, please. So as I said, one of the things that we've learned is that parents and youth can be some of the best best advocates around healthy schools. So I'm just going to quickly share some case examples about indoor air quality, outdoor air quality, chemicals in some common products that are used in schools, play spaces, and end with some positive stories about youth advocacy. Next slide. We very frequently, as you may have gleaned from Maida's talk, get many inquiries related to indoor air quality. And so one of the primary resources that we can recommend and direct communities to is the EPA Tools for Schools Indoor Air Quality Program. This is an extensive online and also app-based action kit that guides schools and districts in how to manage indoor air using educational resources and checklists. Schools are instructed to convene a committee that includes various stakeholders. So these include people who work inside of the building, as well as parent representatives. I've participated in these before. You can conduct a walkthrough of the school, look for indoor air quality hazards, and then be instructed on how to implement low cost or even free and safe interventions to improve indoor air quality. And what's really important to note here is that we know that implementing programs like these effectively improve indoor air quality, and they can also reduce school absenteeism and improve school performance. So indoor air quality is really a key factor that dictates student health and well-being in the classroom. Next slide. So similarly, our colleagues at the Children's Environmental Health Network's Eco Healthy Childcare program provide training and guidance on best practices to create healthy indoor environments for childcare facilities. And so they cover a wide range of topics through both an online certification program and checklists that programs can utilize. And so if you happen to be searching for childcare facilities, this is something that you can look for. You can look for this certification. You can also encourage your own childcare facilities to adopt a program like this or to go through this low-cost certification. Next slide. So we know that indoor air quality is really heavily impacted by the use of cleaning chemicals in the classroom. You may have heard that indoor air quality can be 5 times or more polluted than outdoor air quality. This is in part due to the products that we use indoors. And so in COVID, we really saw an increase in the number of inquiries that we were getting about the safe use of cleaning chemicals and disinfectants. And so we developed guidelines for homes and schools, and both the EPA and Eco-Healthy Childcare programs that I mentioned previously also provide extensive training and guidance on how you can implement a green cleaning policy. And these have been adopted by many states and school districts. And so importantly, policies like these include the use of certified and least toxic products. So often these come with the Green Seal or Eco Logo or Safer Choice certification. They recommend against the use of harmful chemicals that worsen air quality and that can lead to asthma, like bleach or quaternary ammoniums. Recommend using fragrance-free products, and importantly, no products brought in from the home. So often teachers or parents are well-meaning and they want to bring in their own cleaning chemicals or air fresheners and other products like that. And these are, if your school district has a green cleaning policy, these are strictly forbidden. We also saw during COVID the uptick of the use of things like foggers and misters. And so we were providing guidance to schools around not using those types of devices that really aerosolize and spread these products into the air and increase the risk of inhalational exposures. And Maida already mentioned things like ventilation, of course, keeping these products away from children. So a green cleaning policy is something for those of you that are looking to create a safer environment at school. This would be sort of a first avenue to explore. Next slide. And just to share a few resources that are available, we, through our New York State Children's Environmental Health Centers, have a prescriptions for prevention program that provides action-oriented guidance, sort of in the form of a prescription around a number of environmental health topics. We have a green cleaning prescription, which is shown here. And our colleagues at the Western States PACEUS, Pediatric Environmental Health Specialty Unit on the West Coast, have created a really extensive guide for green cleaning, as has the Healthy Schools Network, which has both national and New York State specific guidance around a host of topics related to healthy schools. Next slide, please. So during COVID, we got many inquiries. In addition to inquiries about cleaning and disinfecting, we had inquiries about classroom air filtration and proper ventilation to reduce the spread of COVID-19 in the classroom. And as Maida mentioned previously, many schools, and this came to light during COVID, many schools have poor ventilation, do not have HVAC systems, and do not have a way to really keep the air clean in the classroom. Sort of the gold standard for air purification, air filtration, is a HEPA air filter, which can be very expensive to purchase. And so what I'm showing here is a real kind of success story that came out of the COVID-19 pandemic, which was the creation of a low-cost DIY air filtration system called a Corsi-Rosenthal box, named for two engineers, David Corsi and Jim Rosenthal, who invented this device. And I'm really happy to say that this is something that has been adopted in classrooms. It's EPA and others at UConn and other research institutions have shown that these boxes, which can cost less than $75 per unit to create, are as effective or more effective than a HEPA filter at cleaning air inside of a classroom. And so in the state of Connecticut, just in the last few months, the state awarded $11 million to the University of Connecticut to put these devices into every classroom, every public school classroom across the state in an effort to improve equity and improve air quality. And you can see here some students in Connecticut creating their own Corsi-Rosenthal boxes. So this is another avenue to explore for those of you who are interested in low cost and equitable devices to improve air quality in the classroom. Next slide, please. So I think we talked a little bit also about how outdoor air quality can worsen indoor air quality. One source of harmful air pollutants is idling buses and other vehicles. So implementing anti-idling campaigns in your community can be an effective way to improve children's health. In New York City, we have a robust but somewhat difficult to enforce anti-idling restriction law and citizens reporting program. This law was recently improved to limit idling on school and park blocks, both on the same and opposite sides of the street, to less than 1 minute. So for those of you in New York City, this is something to be aware of. And for those of you outside of New York City, to try to model in your own communities. In addition, the EPA operates a clean school bus program, which provides grant money and rebates for school bus electrification. They're currently taking applications now. So again, if that's something that's of interest in your community, you can take a look at that. Next slide. And then another really excellent program that's available in many states is the Air Sensor Loan Program. This provides schools or community groups with a free purple air monitor, which provides 10-minute averages of particulate matter pollution and populates it to a map in real time. So you can take a look at the communities around you who have these purple air monitors installed and see what their air quality is in real time. This program is really excellent because it provides extensive curriculum for use in the classroom as well. So lots of educational materials that can be incorporated into the use of these monitors. Next slide. And then Maida already highlighted another free program available through the EPA that helps with education and advocacy around outdoor air quality, and that's the EPA Air Quality Flag Program. So this allows students to put up a real or a virtual color-coded flag that lets the community know about existing air quality. And so thinking back to the example that Maida shared about the days that the skies turned orange in New York, having an active air flag program in your district can help to proactively prepare schools for poor air quality days, which unfortunately may be on the rise, and let students and school staff know when it's safe to go outside and when precautions need to be taken. Next slide. So perhaps even more now than inquiries about indoor air quality, we get inquiries about safe and healthy outdoor play spaces. Outdoor play is of utmost importance, of course, to children's health, and children should really be able to be outside safely playing every day. But we are seeing an increase in the installation of synthetic field and playground surfaces, many of which contain chemicals of concern, which children can be exposed to, and also expose children to extreme temperatures. Particularly with the increase in high heat days that we're seeing. And so this is something that we can talk more about in the discussion. There may be questions, but we highly encourage that school districts explore properly maintained organic grass fields, advocating for pesticide-free spaces, which the majority of schools in Connecticut and New York have now by law, and considering other types of natural surfaces. Next slide, please. And since I thought that there may be many questions about this, I've provided a QR code here, which links to some of our additional resources about artificial turf and health risks. So you can use the QR code and we can provide that link later. Next slide, please. And so lastly, I just want to highlight the importance of youth engagement and leave with a couple of really positive stories around issues that impact the health of schools and communities. And so some of you may know that in 2021, New York City law was updated to prohibit the use of synthetic pesticides in New York City parks and public spaces. So we now have pesticide-free parks in New York, but you may not know that the impetus of this was started in a kindergarten classroom of a teacher named Paula Rogovin at PS 290, whose students wanted to approach their city council member about an issue, and they decided to talk to him about the use of harmful chemicals in the parks where they play. And they went down to City Hall. This is Paula with her students at City Hall with then council member Ben Kalos. And it was not, so these students were in kindergarten when this started, and when they were in 7th grade, this ban went through. They persisted, and New York City ultimately in 2021 banned pesticides in public parks, and it started in a kindergarten classroom. Next slide, please. And so to this end, we at Mount Sinai have created resources for youth, understanding that educating youth is really the path forward. And so you can find some of our youth-oriented materials as well as curriculum that can be used in the classroom through our Healthy World, Healthy You story and activity book series. Next slide. And in addition, we, for slightly older students, through the New York State Children's Environmental Health Centers and Mount Sinai, have a a summer program for students across New York State. And this year, students focused on how to protect students in school buildings from the impacts of extreme heat. And they learned how to do things like map vulnerable communities, how to contact their local legislator, and the program culminated with presentations for local legislators where they advocated for protective policies like one that is currently in front of the New York State governor waiting to be signed, which would establish a maximum temperature of 82 degrees in the classroom, at which precautionary steps need to be taken, and that students cannot use classrooms if the indoor temperature reaches 88. And this has been supported by the teachers union and is just waiting for the governor to sign. So this is another avenue that we're taking to help promote healthier schools and engage youth in advocacy. Next slide. And I just wanted to end by highlighting a couple of our other youth engaged partners. Cafeteria Culture is one, which has done a really incredible job across New York City schools and has implemented national programs around waste reduction in the cafeteria, all very much student driven and curriculum oriented to adhere to educational standards. They now have a plastic-free lunch day, so the next one will actually be coming up in April 2025, and they have a lot of resources if that's something that you'd like to get your students on board with. And our other partners at a high school in Washington Heights, Wheels, who have implemented, who are planning for a clean air green corridor, which would be a green corridor outside of their school that would provide green spaces and car-free spaces for the students in that school. So just two of many examples of youth and student advocacy that are improving the health of their schools and their peers. And I think with that, we will go to the last slide and open for Q&A. Yes. So if you would like additional resources and information, I know this was a lot. We have a number of educational resources that you can access if you scan the QR code here. And I think that there will also be, there is an evaluation link in the chat, and I will pass it back to Kirsten for questions.
Thank you both so very much. That was a fantastic presentation, and let's get right into Q&A. So our first question for you is, speaking of school grounds and heat and toxins, what about synthetic turf surfacing and tire rubber playground surfacing? And Dr. Evans, I know you mentioned this, but can you give us maybe some more specific guidance on what resources are available? Maybe touch on the research that Mount Sinai is doing and the statement that Mount Sinai has put out about it in case anybody needs to get to that.
Sure. So, for many years, we at Mount Sinai have had concerns about the use of artificial turf playing surfaces for children, in part because of known carcinogens and neurotoxins, heavy metals that have been found in the turf fields, particularly those that are made with recycled tire crumb rubber. And in addition to concerns about chemical exposures, there are concerns about heat exposure. So some artificial play surfaces have been measured at close to 200 degrees Fahrenheit. So hot enough to cause second-degree burns, heating the air above the field to temperatures that can cause heat illness and heat exhaustion. And this is really of concern with the number of increasingly hot days that we're seeing. And so because of this, and because we received so many inquiries from concerned families and communities about the use of these products, we do have a position statement, which is available on our website. I had flashed up a QR code that will take you there, which sort of describes many of those concerns and refers to the literature around the use of artificial turf. So when it comes to artificial playing surfaces, we know that there's a safe alternative, and that's natural grass. There's a perception that the artificial surface provides a better and more easily maintained, maybe less expensive play area for children, but the evidence really shows that that's not true, and an increasing number of communities are successfully maintaining natural grass fields, which provide a safe and healthy space for children to play. And we can put, Carla did put in the chat a link to get more information about that. I usually give something like an hour-long talk about that topic alone, so it's a little hard to summarize, but.
No problem, but thanks for that. Let's move on to our next question, which is, I know you mentioned the importance of indoor air quality and air purification and the importance of HEPA air filters. Are there some air filtration systems that schools and even families in general should stay away from? I'm thinking about ions or ozone, and can you talk about the dangers of that?
Yeah, that's absolutely right. You do want to make sure that the reason that you're putting it into the home or the school is to clean the air, and you don't want to be adding any potential concerns as well. And so when it comes to air filtration devices, the specific concern is around filtration devices that may contribute ozone. And Consumer Reports has a great guide on filtration devices that you can use when you're selecting one specifically for the home. But for schools, I'm happy to pop into the chat a variety of resources that are available that can help you when you're navigating those decisions at the school level.
Great, thank you so much. Next question, similar to indoor heat bills, is anyone advocating for an outdoor heat bill, specifically taking into account the heat on surfaces?
I'm not aware of an outdoor heat bill that takes into account the heat on surfaces. Often we see, again, on the question of artificial turf surfaces, products that are advertised as being cooler than some others. Maybe they're a lighter color, or they're, have a coating that keeps them cooler. What we do know is that the plastic grass blades do not have the same cooling effect as natural grass blades. And so there's a real benefit to having green spaces. I'm not aware of any legislation that is addressing that. I would be curious to know. It is an extreme problem for children. Children don't regulate their body temperature as efficiently as adults do. They may be less likely to hydrate. And so, unfortunately, heat illness and exhaustion is a real health risk for kids.
Great, thanks so much. The next question has to do with gas-powered leaf blowers in schools. Some parents are concerned about the noise, the air pollution associated with that. So are there any resources, fact sheets, guidelines, or can you just talk in general about any success you've had with helping people with this problem that you can share with us?
Yeah, this is another area that we've done some advocacy around in terms of protecting children's health. Gas-powered leaf blowers are very inefficient, and they contribute a great amount of air pollution into the environment. They should not be used around children. I think that goes without saying. They're also very loud, and so can be very distracting for children in the classroom. There are an increasing number of communities that are putting bans or restrictions on the use of gas-powered leaf blowers in favor of using electric usually. And so we do have, I don't know if Carla can put that one in the chat. We do. Yes. We also have information that we've pulled together to advise communities against the use of those. And we would say particularly on school grounds, that would be a place to avoid their use. They can, the air pollution that's produced by a leaf blower or an automobile or a bus can get into the school through ventilation systems, through windows, through cracks and crevices. So
Great.
That would be our messaging.
Thank you. And just going back, this is a really simple question. I know, Dr. Galvez, you mentioned some handbooks and textbooks that are coming out. Where can people get that?
Sure. So the textbook on children's environmental health, edited by Drs. Landergan and Etzola, is already publicly available. I'm happy to put that in the chat. The American Academy of Pediatrics Green Book, or the Handbook on Pediatric Environmental Health, the 5th edition is coming out. And so I would pause on that one until the latest edition is out. And the other, the yellow book, the Handbook on Nutrition, is also expected to come out in the coming year. The public health textbook is already available through Springer. So I'll pop those in the chat.
Wonderful. Thank you. The next question, we're going back to wildfires. What do we do as parents if the outdoor air quality is at a certain level? I know we can check the apps and see where the air quality is. Should we send them to school with a mask? And what kind of mask works?
Yeah, so I think that the first thing I would do is check the air quality index and see what the guidance is, depending on the AQI in your local neighborhood. If there are concerns about outdoor air quality, particularly for sensitive populations, so sensitive populations include children, as well as children with asthma and other respiratory or cardiac conditions. The mask that's recommended for fine particulates is an N95 respirator, which unfortunately aren't the most comfortable masks for children to wear, but it is the most protective. And you have to make sure it's a properly fitting mask and that it's on the face properly as well. So that's the recommendation.
Great. And next question would be, if you think there's a problem in your school, where do you start? Where do you begin? I mean, I'm happy to share my thoughts on that too, Dr. Galvez, but what are the next steps?
Yeah, and I think so concerned parents and caregivers are really the ones who bring these concerns to the forefront and bring it to our attention. And so we are a resource if you have concerns about environmental issues in your school. I would say that one of the things that we point families and school communities to is the EPA Tools for Schools program. It has a comprehensive assessment of the school environment that can be performed by school administration, building facilities, faculty, and staff to identify systematically concerns that may exist within the school environment, both indoors and outdoors. And then above and beyond that, I would say that where we've seen the most impactful change, quite frankly, is where there has been an organized school community. And we've actually, similar to what Sarah shared around students having great impact, we've seen the larger school community have very impressive impact in affecting change in local school environments with respect to, for example, concerns related to construction. I will say one footnote to the school construction being one of the major concerns that we get calls about, either construction at the site or at an adjacent site. And what we're getting calls about now are more proactive calls around how can exposures be prevented proactively before construction begins. And so that's a real shift in the kinds of calls that we've been getting. And I'll turn it back to you, Kirsten, because I think that the parent perspective is such an important one, and how to navigate that can be so challenging. And so just turn it back to you for your advice on how parents can move forward with any of their concerns.
Absolutely. As a parent, you have to be a parent advocate. So you have to speak up and not be shy to speak up, and then find like-minded parents who you can go into the school with. I think it's hard to be the only person going into a school. And then I also think at the school, it's important to identify who to approach, because not everybody is open to environmental issues. Unfortunately, I think we're trying to move the needle on this. And hopefully in the future, more people will be aware of the dangers of environmental exposure on health. So I think it's about finding the right person to speak with and going in as a group and presenting it. There obviously, in different school districts, it can be political. So again, you have to find an ally on the other side. But definitely don't be shy to speak up, and you can reach out to the Institute as well, as they're a fantastic resource. So with that, we have no more questions. So I just really want to thank our panelists and everyone who came today. The Institute isn't just doing great research. We're working with parents, communities, and leaders to build healthier communities. So I encourage all of you to stay connected and help support this amazing work. Please fill out the evaluation form in the link in the chat, and please get in touch with us and get involved. We would love to have advocates out there on environmental issues. So thank you, everyone, and enjoy the rest of your day and the holiday season.